Oyo State Incident Manager and Coordinator, Emergency Operations Center, Dr. Olabode Ladipo, joins us via Zoom for updates on the death of 2 persons from the Delta variant in the state. Good to have you join us, Olabode Ladipo.
Good afternoon, thank you.
So talk to us about this very sad development in Oyo State, where we understand that 2 persons have now died from the Delta variant.
Thank you very much. We have had in the last 2 weeks 30 cases with 3 deaths. And we've been taking samples from some of the more interesting cases to see what kind of gene expression that the virus had. And it was when we worked with the African Center for Excellence on Genomics at the Redeemers University that the Delta strain was isolated from 2 of our cases, one of which was a deceased client of ours. And with that, quite a lot has been done now. The issue of surveillance is at the fore, and also the issue of risk communication. And that is the process that is ongoing right now in Oyo State. Thank you.
So what I know you've talked about surveillance, which would also, I guess that contact tracing would also be part of surveillance. But talk to us about what is being done to ensure that this doesn't get to the community transmission level.
Thank you. We realized that quite a lot of these variants are coming in from outside the shores of this country. And because of that, we've been working with the NCDC to have daily updates about people that we call passengers of interest, people that travel into the country on a daily basis, so that we'll be able to know those of them that have Oyo State as their final destinations, and we follow them closely. That has helped. It has been able to help us calm down on some people. But more importantly now, we're working with the local government authorities to go through each community, ensure that people with signs and symptoms of COVID come out willingly now to test, and also try to see how best they isolate, especially when it comes to people that have any suggestions of harboring such a disease before the state comes to ensure isolation either at home or in the facilities designated for that. So the issues pertaining to surveillance is really high. And then we've been able to also look at the issues pertaining to testing. With the NCDC, we've been able to have more facilities for testing, especially in the area of the rapid testing. We now have the facilities to test and get results within a matter of minutes, though we might be willing to confirm under the more gold standard method of PCR. But
Dr. Olabode, I'm sorry, I have to interject because I spoke with a public health expert yesterday who mentioned that one of the challenges of this Delta variant is that it doesn't show symptoms as the earlier variants that we had. So somebody can have it and not necessarily know that they have it. So what are you watching out for? Because you talked about surveillance earlier. So what are you watching out for?
The interesting thing about what we have in Oyo State now is that it's not that we're not having people with symptoms. They do have symptoms. Part of their symptoms are those ones that people usually ascribe to something like malaria. We've had quite a number of our cases coming down with muscular aches and pains. And then more distressful is the manner of presentation with diarrhea that we've been seeing of late. And these are the two that we are actually seeing more than the respiratory distress that precede presentation before now. But then we still have some of them still coming down with the respiratory distress. So those symptoms earlier noted with COVID But with these two that I've actually pointed out now, are things that we are so much interested in here in Oyo State.
All right. I wish I had enough time to talk to you about whether you're looking at enforcement in terms of the guidelines and non-pharmaceutical guidelines, but we do not have enough time. Oyo State Incident Manager and Coordinator, Emergency Operations Center, Dr. Olabode Ladipo. Thanks for talking to us.
Thank you for having me.